back to him in the endo room again?
Couple strokes. Might want to doctor.
I mean, he was trying to do the anesthesia and the tech and the...
Yeah, that's right. I heard it today, didn't I?
Yeah.
Holy mackerel, I was looking for extra pay, my paycheck, but I didn't see any. Did you get paid a full amount?
All right, you can step out.
Okay. So I have to drink that syrup or
Yeah.
whatever. Oh my god.
Yes, you do. Any headaches, nausea, vomiting, bleeding, or discharge?
No.
Okay. Super. I have to share with you, my daughter is expecting, and she's, when are you due?
February
February.
10th, like around 10th.
Okay, that,
Because it was February 10th,
Yeah.
but it was before we did the ultrasound, so
yeah,
I don't know after ultrasound, like the measures and
yeah.
what's the
So
date.
she's due within days of you.
Mhm.
And it's funny when you said it's as big as an eggplant because she tells me every day.
Yeah.
She's also following that same application.
She is, yeah. It's as big as a papaya.
I
It's
know
as
which
big.
one.
This one. It's as big as an eggplant. And she's much larger than you, but she's a bigger girl. So I'm just rolling in there, the baby, a little boy.
Yes, but it's like before it used to be more movement, now it's less, and it's like I hear like some
Oh
little
yeah.
beating, like a little, I don't know what's that.
Okay.
So I'm gonna see how the doctor.
Yeah. Oh, I've been trying to baby this cord here, as you can see, for a while now. And it's just getting to the point where it's not.
He wants to part
Yeah.
ways.
It does. It does. So let's see. Well, no, 8/7. That's good. Alrighty. I'll send him in, okay?
Oh, no, she should have started.
Morning.
How are you three?
Yeah.
They will.
Good. You made it here in the cold.
Oh yeah. Was ice fishing yesterday, so.
Yeah, it's a little nasty
Crazy.
out. Yes, I agree.
That's crazy.
Very cold. I don't like it. But nobody cares. It's just cold. We have to deal with it.
Yes, this is cancer. This is where we choose to be.
That's right. How you feeling physically?
I'm feeling good.
Yeah.
Still have pain, like sometimes when I stay too much in my feet, I still have
Yeah.
pain. And but it's like I don't know, like before last week I was feeling more like movement. Now it's a little bit less, but I hear like beats, like
Okay.
lower,
Yeah.
the lower or here. Right now I was feeling like tuk. I don't know what's that.
Well, I'm sure it's likely the baby still. Part of the issue is most women, as they get into the about 30 weeks or more along, they start to feel baby a little less because the baby's starting to get scrunched in there a little bit more. But we'll listen today and see what the baby sounds like. You're not having any bleeding?
No.
Okay. And no symptoms of concern with going to the bathroom, urinating at all?
No.
Okay. So it doesn't sound necessarily concerning, what you're describing. If the baby wasn't moving at all, I'd be more worried than maybe just moving less.
No, it's moving, but it's like I hear this bit, so
Sure.
I don't know.
But it says like hiccups or gargling, something.
Could
Something
possibly be, yeah.
Yeah.
It'd be hard to know unless all of a sudden you were doing a picture right when this was happening and saw it. But
We're talking about, because she said that right now it's, the baby is kind of starting to engulf some of the fluid. So how does the connection go in and out through the cord? I know that it gets fed and breathes through the cord, but how does it release stuff? Is it just releasing in the?
how does it release, like urine in that?
So it's floating in that.
Yeah,
stuff, right?
so basically all amniotic fluid is primarily urine. And the baby usually does not have a bowel movement until either after delivery or just before delivery.
Yeah.
And that can be an issue if they have one before they're born.
Yeah. That's usually the black stuff.
Yeah, and we don't have any way to necessarily keep it from having that happen while it's in utero. But yeah, the baby gets fed through the umbilical cord. It technically doesn't take mouth or nose breaths like it would once it comes out. It's pretty amazing how the body actually, essentially in the delivery process, expels most of that fluid. Not all of it, because still there's some that the baby will bring up after delivery. But that happens all in the process of the delivery process, labor and delivery process. So it's hard to really explain more than that to the situation, because I don't think a lot of people understand, even doctors understand fully why it happens the way it happens. But we know that the compressive forces of labor tend to start to expel some of that fluid out of the body, and it's not until the cord's actually clamped and cut that the baby's no longer getting stuff from mom. So
because it basically stuff goes in, but stuff doesn't really go out. It stays in that amniotic fluid, or?
there's actually stuff that does go back.
Oh,
that,
okay.
So there is
a return, yeah.
Yes, there's vessels that take blood to baby and a vessel that takes blood away from baby through the cord. So there is breakdown products and all that do get still, and then mom excretes that technically.
Yeah, because kidneys and liver already work on the baby. Yeah.
Exactly. All right, so you are 28 weeks along, so you have to get a shot today. Well, maybe 2. Have you gotten a flu shot yet?
I got the flu shot.
You did get the flu shot, so we're good there. But we got to give you the Rogam shot because of your blood type being Rh negative. Did you drink the orange stuff yet?
I told them, and I told the nurse too, and nobody brought me.
All right.
Nobody sent me anywhere.
The juice.
Yeah.
Yeah. Okay, well, I wonder what that's about, but we'll get you the juice. Yeah.
Okay. So now we need to listen to the baby.
Yep. Check the measurement first of the abdomen. The hands are probably freezing, sorry.
Fine.
So you measure okay. So you're getting pretty excited? Getting closer.
Scary about the delivery or no? I thought it would be the small.
125. Good. 121 to 133. It's falling in that range, so that's normal. Low normal now, but it's normal. Alright, so let me move this back over here. So what we'll want to do is make sure that you get to drink the orange stuff. Then you get a blood draw an hour after, and you also got to get the shot for the RH or the blood type, and then you're at a point where we see you now every couple weeks, about every 2 weeks roughly. If it's a little longer, depending on your schedule, that's fine. You know, you're doing well. Pregnancy's overall going smoothly. It doesn't have to be exactly every 2 weeks. Whatever works best for you with your schedules are fine. No question's a silly question, so things come up, you know, don't hesitate to ask, because just like what you're feeling, which is hard for me to know for certain, is that hiccups, is that positionally the way the baby's suddenly sitting, that you're feeling things a little different. It could be a little both, but the baby sounds good. Some movement's still a good sign. If ever you felt like a baby's definitely dramatically less movement, or you're having bleeding, you've got to let me know, because that could be a concern. Now, there's a lot of times when that does happen to women where it ends up being nothing concerning, which is good. But if you were having any symptoms like that all of a sudden, then you got to tell me, because a reassuring thing is baby moving. Even if you felt a little different or felt a little weird or weren't feeling good, a baby that's active is a good sign that things are probably fine, and it just might be your body's not feeling the best. Heartburn can start to become more and more common as you get later in pregnancy, where your stomach might bug you some. If it becomes enough of a problem, you can use medicine like Prilosec or Pepcid or even Tums to help that. It may not be a problem though. Sounds like your back and your leg are going to continue to be the maybe biggest annoyance, and you know, if that keeps being an issue, you can for that even see someone to get some help for that. But part of that just depends on how it keeps going. All right, so I'm gonna go let them know to get the juice.
So we need to wait an hour after.
Yeah, for that blood draw, and then assuming that's normal, like I think it will be, then you shouldn't need to deal with any more of that, because that's just screening for sugar diabetes in pregnancy, which is important to screen for. I think your risk is low that you'll have that, so I'm not too worried about it. So, okay. All right, I'm gonna go let her know.
Thank you.
Yep.
Thank you.
Stay warm out there
Yeah, so we
as best you can.
We'll do our best. Thank you.
In the boom.
Okay.
I'm going to give you this. This is to carry in your purse if you were ever in a accident and someone needed to know your blood type. So this is for you to keep in your purse, okay? You're welcome. Okay, so, yep, just need right there. All right. Do you want to sit on, or stand on?
I don't know.
Why don't you stand down?
Okay.
Perfect. And I
Is that gonna be too
apologize.
much pressure on this leg?
You're okay, whatever you feel comfortable doing.
I don't want the muscle to be tight, so it's gonna be painful. I hadn't had one on my hip.
Never had one in the butt?
Since I was a kid, I think.
All right.
I'm afraid. It's gonna hurt?
It's going to hurt a little bit.
Oh my god.
Okay. All right, I'm going to count to 3 and I'll poke on 3, okay? 1, 2, 3, poke. Sorry. Just putting the medicine in. All done.
the smiley face on her butt now.
Okay. Oh, you're all done.
Oh my god.
So
Yeah.
technically what this does, it protects the baby from being rejected.
That's correct.
Okay.
Yep, that's correct. And then when you are postpartum,
Mhm.
you get one more.
Yes. For the next.
Yeah.
When-
The joys. It's all going to be so worth it, though.
Oh yes.
Yeah. Okay. Well, you guys are all set. We'll give you a call on that test for the sugar that you took.
Yes.
We'll give you a call, hopefully today, and we'll be in touch. Okay.
Thank you so
All
much.
right. You're welcome.
How have your sugars been?
All right. Sometimes a little higher, but
Mostly acceptable?
Yes.
Okay. Baby's been pretty active though, huh?
Mhm.
Dancing away in there.
yes.
You're having much heartburn or not really?
I had it for a little bit,
Yeah.
like for some days, and then again stopped. Like
calm down.
yeah.
Okay.
And then I think after we left here because we did the 3G,
Yeah.
and I was talking like I don't have the heartburn, and second day started. And it,
How was that experience? Was that fun?
yes, a lot of fun.
Your ankle's doing okay still? No
Yes.
swelling? Okay. Let's check the baby out here. So do you guys have to go anywhere for Christmas?
No. Gonna stay home,
Yeah.
family. Sometimes I have pain in here. I don't know why. It's because of the
So,
shingles.
say that again?
It's like it's pushing or
Yeah.
something.
So a lot of times as you get into the 30 plus week range, the baby starts to put a little more pressure on the pelvis area. That's not uncommon. And it's hard because you can't really make that go away. It actually might become a little more regular and intense, but that's usually what that's from.
It's usually when I sit and I stand very fast
Quick
or yeah.
movement, yeah.
Yeah.
Measure right where you should, so that's good. Alright. 133.
Same as last week.
Yeah, right around 130 to 133. They didn't find twins, huh?
No, it's not even a boy. It's a girl.
It's a girl, huh?
Yes.
Is that good?
It's always good.
Yes.
Yeah. Just making sure. I agree, healthy's all that matters, but
Yes.
some people were, maybe were thinking, it'd be nice to have a boy or it'd be nice to have a girl. They have preferences sometimes, but in the end, you want a healthy child.
That's all that matters.
Yep. All right, we have 3 boys, so we we don't have any girls.
So you can only wish for next year, huh?
I think we're done.
It's okay.
Keeps us active.
You can only imagine 3 boys.
It's a little loud at home. Wrestling. All right, so plan on 2 weeks again for follow-up. And certainly, Actually, you know, we could stretch it to about 3, so we're right after the holidays. So why don't we plan on maybe sometime after the 1st, that following week or whatever. If something comes up, don't hesitate to let us know. But things seem like they're going great overall. You're measuring fine. Baby sounds good. The baby's active. For the most part, you feel okay. And the sugars sound like they're okay overall. And you were borderline anyway. It wasn't like you were right into the gestational diabetes
How much
range.
is the borderline already?
So you were just a few points from technically being gestational diabetic. So that's why I figured it was still worth kind of giving that extra education on what to do and monitor, and kind of so you know, and I know that that we're not converting as we continue to go in the pregnancy into suddenly a gestational diabetic when you were so close to not quite making the cutoff in the first place. So I was surprised because you're a fairly petite woman, so to have gestational diabetes would be less likely. So for you to have a sugar that got close to the cutoff made me think, well, then it's important that we watch you a little bit and help you with that, just because gestational diabetes increases on average the size of the baby, and makes it then, of course, in theory, a little harder to push the baby out too. Yet there are some women that make a 10-pounder look easy to push out, and some that struggle with a 6-pounder because maybe the baby's not quite coming down the right way, that maybe the head's turned just a little bit and it doesn't want to line up right. So there's a lot of things that have to go, in a sense, just right, yet a lot of times the body knows how to do it. It figures out how to get the head in the right spot, and so we'll just hope that that all goes exactly like that.
I hope it too. It's dropping.
Yeah, low normal. Baby's ready.
It's getting ready.
Yep.
Seriously. Oh, yeah.
Blood pressure looks great. Your urine looks fine. No headaches or bleeding or anything. No contractions.
I don't how it
None,
looks
none
like.
that you're aware of, at
No.
least. Okay. And usually you'd have tightening of the uterus that lasts like 30 seconds and happens every so many minutes.
Sometimes I have like a little bit, but it's like just a
short,
belly type.
short
It's
amount.
much-
And it's,
Nothing.
ankles are holding up still? Not
Yes.
real puffy at
No.
all? Alright, let's check out the baby here then.
Mhm.
Okay.
So maybe at some point what you call hiccups will turn into contractions.
A lot of hiccups. Even during the night.
Well, that would be good eventually, right? We need
Oh.
something to happen. Some point. A little icy out this morning. Baby's moving just enough in here. That's good. Kicking and everything. serious movement over here. Definitely a mover and shaker this morning.
She's turning to the microphone.
Yeah. Trying to sing.
Finally, we got some video of her moving
Yep.
all the time, like she's moving, and when you put the camera, it stops. It's like she doesn't like it.
She was definitely moving today. Holy cow. So, sounds really good overall. Moving a lot, which is always reassuring, and active baby is always reassuring overall.
Yeah.
So we just keep on doing more of the same. It's basically if we get right around your due date and nothing's happened, then we're going to talk about how to help. Because sometimes it just needs our help. Sometimes it will not happen. It won't go into labor without
I
intervention.
need to maybe to do something,
So-
move or something.
Yeah, well, right.
Something.
Go for. Well, I wouldn't go for a walk with the ice right now, but yeah, I mean the reality is hopefully you'll get the all of a sudden obvious help. I'm contracting now, or the water breaks, something along those lines. But depending on what's happening, if something's at all, you're wondering is this labor, then call and ask, and if we need to, we'll have you come in to check it out because it's going to be one of those things where for most people it's pretty obvious, and other times it's not always very obvious. And people might have some subtle things and are wondering, is this the start of labor? And so if there's any question, just call. But we'll keep doing the once-a-week visits, and then probably in about 2 more visits, depending on if you haven't went into labor yet, we may check to see what your cervix is doing again to decide, okay, well, how easy would it be to help you? And then figure out when to help you based on that. So it's safe to let you go as long as 41 or more weeks, actually. Usually I don't have people go past 41 weeks without trying to help you. Most people are wanting to be done by then too. So they've had enough, and if it's not happening, they want to know how can we make this happen. So we'll just see how it keeps going, but everything's reassuring. Baby's growing fine, obviously moving well, heart tones sound normal. So okay.
I hope it's gonna be like just a water break and that's it.
Yeah, that would be simple, straightforward, and we know that you're committed then. Committed to the hospital.
Yeah.
All right. You guys have a great day.
Thank you very much.
And we'll see you in a week and sooner if it's happening.
Yes. We'll see.
Hey, by the way, she's pregnant. Did you know that?
Yeah, I noticed.
Thank you.
You're welcome.
Move.
You haven't had anybody tell you that she's pregnant yet, have you?
Couple of times in the
Couple
last
times
week.
they're still doing that?
I'm still getting surprised every
Yeah.
time. Acting along.
Measure about the same as last time, which isn't surprising.
You didn't grow too much?
No, pretty stable.
Yeah.
Alright, time to find the baby.
It's somewhere there. Hide it.
Not as easy to hide anymore. $125 to $130.
That's good.
Yeah. A little lower than it's been, but it's still okay.
So when it's time to come out, it's supposed to be the same like one.
No, the heart rate can be kind of, I mean, you were used to it seeing anywhere between 115 and 165 during pregnancy. Usually in the beginning of pregnancy is high, and as the pregnancy goes along, most babies, the heart rate starts to come down some. So the baseline for a lot of babies around this time is 120s or 130s and sometimes 140s. for you today, it's 125 to 130. Last time I think it was in the 130s. So, but yeah, the baby's definitely
There.
it's there, and it's slowed up a little bit heart rate, so it's okay.
It's not time yet.
Not yet. Have you even noticed anything that made you wonder if at times you've contracted a little bit or not really?
I had like a little contraction, but not.
Nothing substantial.
Dropping.
So next week, what we'll do, assuming you're still pregnant, a week from now.
We'll see.
Right, we'll see what happens. But assuming you're still pregnant, we will actually check the cervix to see if it's trying to do anything or not, to decide when would we possibly try to help you. How long do we let you stay pregnant if nothing wants to happen without help? Because if the cervix is favorable, trying to start to do something, even if you haven't noticed evidence something's happening, if the cervix is getting ready, then it's easier to help you get into labor. If the cervix is still closed and doing nothing, it would be hard to get you into labor. But that way next week I would check what it is and kind of help decide with you what's kind of the don't go past date. That we would, might be still a few weeks. But you and I would kind of decide on how long do you want to potentially be pregnant yet, / how favorable is the cervix to know what could we or couldn't we try to do to help you if you don't just go into labor on your own. So obviously if you don't go into labor by next week and we check your cervix, we may set a date for whatever, a week or two later to make something happen. You still could go into labor between me checking you next week and that date we set, which would still be ideal. I'd still rather your body just decide it's time and it wakes up and it does something. But first time moms, it's actually fairly common to need some help.
Yeah.
When I think about most babies I've delivered and a first time mom, those are the ones more commonly we have to help get into labor. And they tend to go past their due date because things don't want to wake up. So.
We start pushing, like moving stuff in the house.
Oh, I wish I knew of a way that would definitely get you into labor, but all the things out there are just myths.
Yeah.
They don't work with certainty. So, not that you can't try them. It's just feeling done.
Feeling done.
Yeah. It's looking more like that just by your facial expressions.
It's like, come on, I'm waiting and waiting.
So am I.
Yeah.
Not as much as you, but yes. Alright, so baby's been active?
Yes. Still moving even now.
So your urine looks good again, blood pressure looks good, no headaches, swelling in the ankles, or not really?
Not really. A little bit, yes. I think it's the water already. Like,
Yeah.
Some cramping.
yeah, I had it like
Yeah.
today in the morning. In the afternoon.
Let's check the baby over here. She's still pregnant.
She's pregnant, big time.
Big time.
Doesn't help her. One of our friends just had her baby today.
Uh-oh.
Yeah.
Where'd they deliver at?
Madison.
Madison. Okay. $130. 130s. Sounds good. So the question I have for you, so you're 39 weeks, 1 day along right now. So we have some options. You check, you beat me to it. Good man. We have some options. We could, well, let you alone and see you next week, assuming you're still pregnant. And then at next week's visit, if you were still pregnant, we could check your cervix and decide when are we going to help you, assuming you continue not to go into labor without help. So in other words, typically we will plan to help somebody by inducing them if they are 40, 41, or 41 plus weeks along. You're 39 weeks, 1 day today. I don't have any medical reason to force it technically, but at some point we know that the risk actually of letting the baby stay in there indefinitely gets greater than helping you out, and you're going to certainly want some help eventually if nothing's happening. So ideal world, baby just decides it's time, something happens, water breaks, or you start contracting and the cervix starts to change and we're in good shape and we never even had help. Or we have to help maybe a little bit while you're in labor, but you got into labor on your own. All good intentions, though, sometimes it just doesn't happen and we have to help you. So usually I like to help people somewhere between 40 and 41 or 40 and 41 and a half weeks. But part of that depends on kind of your tolerance of how long you want to stay pregnant too. Realizing still the ideal situation is hopefully you just go into labor. So if we at least make a plan for a day that we won't go past, but you go into labor before then, great. If you don't, at least we know what day we're using, and the OB department knows when we're using it, so that way we don't suddenly get to be really close to the day we want to make something happen, and then we call and they say, well, that day we got a C-section on somebody and we can't do it, and because they like to only do one planned induction or C-section per day, and they don't like to do them on a weekend. If you come into labor on your own, that's one thing, because we can't stop that. But someone where we're forcing the issue or planning a C-section on, those situations, they only like to do one a day on a weekday. So that's why I'm trying to think a little ahead, and trying to plan for when do you want to do something no later than. Like what date no later than do you want to have a baby?
No later than 20th, I think.
20th? Okay.
Yeah, no later than 20th.
So today being the 4th. So then I think what we do is we see you next week, assuming you're still pregnant, either Tuesday or Wednesday, one of those days, because then on Tuesday you're 40 weeks,
Yes.
on Wednesday you're 40 and 1. And then we maybe shoot for one of these days, because that would put you around 41 weeks. And here, yes, you're 41 and a half, but a lot of times that there's a small chance that if I plan for a Friday, so Thursday I'm not in clinic, so I don't like to do them on Thursday because I'm not in the clinic. I'm not right here. And Fridays, I am not a big fan of Fridays, because if two people suddenly Thursday night come in labor and they're kind of swamped suddenly, they're going to push us back. They're going to say, well, maybe she can come in late on Friday, or maybe we'll have her come in on Saturday, because it gets too busy sometimes all of a sudden when we got a plan for what we want to do, and some other women decide they're going to have kids, so they come up and they're in labor. So it pushes us back a little bit. So I think that way, if we plan for one of these 2 days, this is all assuming you're still pregnant here. We plan for one of these days and suddenly they get busy and they have to push us back a day, we're still sometime during this week. So I say we see you next week on one of these days, and that's of course if we don't deliver before then. And then we'll check your cervix that day to know, is anything happening, even though really the whole thing's not happening yet, but is anything happening? Like, has the cervix gotten a little more ready or not? Does it feel like it is? How am I going to help you, presuming nothing happens between this visit and when we do something? So we've got a plan in mind, and then at that point, next week I'd call OB for the following week to be able to tell them, okay, would X day work? Would the 17th work, or would the 18th work? What do you have available? Here's what we're going to do. It's a first-time mom. I'm going to do the following to help her get into labor, assuming nothing changes. So that's how we could plan it. So now, hopefully, all this discussion is for nothing, because you just go into labor.
I hope it too.
but you know, we don't know. And so far, you know, everything checks out fine. Baby sounds good. You're measuring fine. You're not having a lot of puffiness, which is great. You know, overall, you.
I had like 1 or 2 days. I have like some pain on this side, like a needle.
Sure.
Just, I don't know what.
So
just for a little bit.
Short time, yeah. I mean, potentially that's baby positionally the way they're sitting. Like, sometimes too when they're trying to, in a sense, get into the most appropriate position, they sometimes will cause some irritation, although that might last a little longer than what you're describing. I can't say that wasn't actually maybe even your bowels, because on that side, of course, our bowels, through our abdomen, as much as everything's getting pushed out of the way right now with the baby being there, it could have been bowels, but it doesn't sound classic for that either. So it doesn't sound worrisome. Baby's active, you're not bleeding. So I don't know for certain that I can tell you what's definitely doing it, but it almost sounds more ligamentous or baby related. So I think we stick to that kind of a plan, and then, you know, we just hope that you go into labor and we don't have to have any of that happen anyway.
And with those short episodes of when she's kind of really, abdomen is really firm, like for a very short period of time, it's absolutely really firm.
Tight,
like
yeah.
I'm not sure what
So
that's
how
about.
long does that last when you notice that?
Like
Seconds only, or?
no, like almost a minute.
Okay.
Like.
And so do you notice that happen, and then you get maybe 4 or 5 minute break, and then it happens again, and then a 4 or 5 minute break? Or is it maybe it happens and it's 30 minutes, and then it's an hour, and then it's 5 minutes?
Like
and
more
then,
like that, yeah.
yeah, so that's Braxton Hicks. That's a type of a contraction in a sense, but it's not.
So when it's tight and here.
Yeah.
What about the pain? Like I have sometimes I used to have like a little pain like
Yeah.
down.
So that still could be related technically. The upper stuff sounds more like truly a contraction, but it doesn't sound like your pattern is consistent to call that labor. That just sounds like some
But
irregularity.
It's not painful. It's
Yeah, just pressure more,
pressure.
and tightening. Yeah, that's not. That sounds like almost like a false labor pattern essentially, and then even the discomfort down here either again is trying to show evidence of that, or it's again baby in a sense jockeying for position the way it needs to line up. It doesn't sound worrisome. It sounds more annoying than anything, you know, because you'd prefer just the real deal happens and this gets
Right.
rolling, but we're getting there.
Yes.
It's coming.
I know.
We're not going past that week though.
No, I
Something's
don't.
gonna happen.
So 17th or 18th?
Somewhere in there, yeah, I think so.
No, even earlier. I wish. Not
Well,
on 14.
Yeah, I mean, well, we'll see what happens, you know, by next week, obviously, but then we'll figure out based on what your cervix feels like how easy it's going to be to help you get into labor, and we'll just plan based on that. So, okay?
Sounds good.
Hopefully, I'll see you before next week.
I hope it's like Saturday sounds good.
Saturday sounds good? All right, I'll clear my schedule. We're good to go. Have a good day.
Thank you.
Too.
Tormenting Dr. Hibbett in the endo room again?
Couple strokes. Might want to doctor.
I mean, Hibbett's trying to do the anesthesia and the tech and the...
Yeah, that's right. I heard it today, didn't I?
Yeah.
Holy mackerel, I was looking for extra pay. My paycheck was, I didn't see any. Did you get paid a full amount?
I got docked for not being...
Yeah, you should have. I told him the doc would give me
For
something.
not being able to troubleshoot that
The
door.
reason includes no massive saw.
Nothing yet?
Nothing, so just some storage strips and then a 4x4.
Thanks, Him.
Thank you.
In the ABD, right?
Thank you.
It's ready for you to sign.